Okay, parents, your kids are going to turn out just fine.
This episode of the podcast is brought to you by FOCO. That's FOCO, F-O-C-O. If you are a parent of a child or teen with ADHD, you know how challenging it can be to keep them focused and engaged. FOCO is the all-natural solution for ADHD, whether it's for school, homework, or just everyday activities. FOCO helps your child or teen stay calm and attentive. Before trying prescription drugs like Adderall that can come with harsh side effects, I recommend you try FOCO. Visit ThinkFOCO, that's ThinkFoco, thinkfoco.com for more information. Welcome to the Your Kids Will Be Fine podcast. I am Dr. Michael Malevsky, board-certified pediatrician, also a parent of 7, also a grandparent of 3. On our podcast, Your Kids Will Be Fine, we're always trying to find ways to help parents sort through the glut and overwhelming amount of information that seems to come at us everywhere all the time, and to help us make rational, positive choices about our parenting, and also to decrease our anxiety about our parentings, and to know that you're doing a good job and your kids will be fine. This episode of the podcast is really going to be focusing on the mental health issues with kids, and specifically the integrative medicine approach to mental health concerns, specifically ADD. Integrative medicine, when I say the term integrative medicine, what I'm referring to is the approach in adult and now much more accepted in pediatric medicine as the approach that really considers the whole child in all aspects of health, both physical health and mental health, that incorporates an understanding and education around metabolic health, sleep hygiene, gut health, the gut-brain axis, in addition to evidence-based deployment of medications where appropriate, and how all of these things are interconnected and how they all relate, and how we can help individual families, individual kids through this whole person integrated approach that looks at all areas and how they impact your problem. In this case, we're going to be focusing on how they impact mental health and specifically ADHD. So we've discussed ADHD. The reason why I'm focusing on ADHD is, as many parents know, this is by far the most common mental health concern that parents come to the practice and to the office with and want education, want coaching, want a good diagnostic evaluation. But more and more, I'm finding parents are interested and hungry for other ways to approach the issue, approach helping their child with their symptoms before necessarily jumping to prescription medication. And as many of you know, most prescription medication for ADD has to do with prescribing stimulant medication like methylphenidate or Adderall. And even if medication ultimately is what's needed to truly help the child, what can they do in addition to medication? So the conventional approach to ADD has always been a combination of parental training and coaching, helping parents understand how to react in a more positive, less punitive way to ADHD symptoms. Coaching with executive functioning, as we term ADHD coaching, and that kind of depends, and that isn't always as available in some communities and is often expensive because it's generally not covered by insurance. Therapy, such as cognitive behavioral therapy and dialectic behavioral therapy, as ways to improve the child's insight and understanding into how their thoughts and emotions interact to impact their behavior, and ADHD medication, as we've reviewed before and in other podcasts. So let's talk about what the more integrative approaches look like and what are the resources and ways that parents can learn how to implement these when it comes to approaching ADHD. So the first is helping your child understand mindfulness. This is going to be very age and developmentally specific. Lots of younger kids are going to struggle with this and may require maybe more professional people who do this specifically for younger children. But it basically is trying to help the child themselves understand awareness and shifts of their daily activities, analyzing their own automatic responses that may be emotionally based, and help them be emotionally present in the moment so they can then maybe predict and understand how daily situations and changes in how they feel will affect their response, and how to be more present in that to make different choices. It's not easy. It's a skill, but it can be taught and it can be coached. The second is helping kids understand their diagnosis in a different way, that ADHD really shouldn't be viewed as something wrong with me or some kind of disorder, but rather just a different operating system. That it is a different way that your brain processes emotions and information, and that you just have to understand that and hack your strengths and learn how to overcome the weaknesses like all of us have, and that there's nothing necessarily, it's not something wrong with you, and that's a different way of just understanding yourself. Lifestyle habits, really focusing on like sleep, hydration, and nutrition, how all those affect our emotional and cognitive regulation. um, I start that process in terms of lifestyle habits, first focusing on helping parents understand the role of exercise. There is a huge body of evidence to talk about how muscle activation and aerobic activity on a regular, ongoing basis has a huge impact on emotional regulation and executive functioning and cognitive function, especially in kids with ADHD. The trick to this is to find ways for the child to engage in this if your child is not already predisposed to this because they're athletic or they're in a sport, but in a way that they choose, that they find fun and interesting. So that also doesn't become another punitive activity that they feel they're being punished for and have to do. So that is a challenge, but that also depends on the child. But exercise is hugely important to find a way to integrate that. Nutrition is the other big pillar of the integrative lifestyle approach. There have been many studies on the roles of different diets when it comes to ADHD symptoms and behaviors. There has never been any particular diet that, when applied over a large population of kids, has been shown to have any specific advantage over another. So I focus on, and like many integrative medicine approaches focuses on, what is the diet that promotes the best metabolic health, which then for sure has downstream effects on gut health, which will for sure have a positive impact on your emotional and cognitive functioning. The basics for that are, as many people I'm sure won't be surprised to hear, decrease intake and reliance on ultra processed foods and understanding what an ultra processed food is versus what it isn't. But refined grains, added sugar, unhealthy fats such as seed oils, and their impact on gut and metabolic health. That is definitely a household issue, not a child issue. So it's important to educate the whole family in that area. And connected to that, exercise and nutrition becomes ultimately coalesce into the gut brain axis. The gut brain axis is the two-way link between your emotional and cognitive brain and your intestinal function, especially as that is expressed into the microbiome. We know that having a healthier diet in all the areas we talked about, as well as regular exercise, improve your microbiome health, as well as the addition of foods that, including high fiber foods and fermented foods and foods that provide a improved probiotic balance. My favorite that most kids seem to accept is kefir, which has been shown, a cultured milk product found on most dairy shelves of most supermarkets, really has a potent, long-lasting positive effect on gut microbiome. And then the last part of um, integrative health is really where supplements can come in to help upgrade all of those areas and make up for the shortcomings that may not be present in our own diet. It is very clear, and many more thought leaders and credible content creators are showing us that even when you go after and try to buy the healthier foods and unprocessed foods, the food supply is different than it was a generation or two ago. Their soil quality and farming practices have just nutrient depleted a lot of the foods that we buy compared to foods in the past. So that's where supplementation can become an important adjunct to the integrative approach. What are the main supplement focuses? What's the main supplement focus that I use in ADHD? It revolves around three or four things. So one is a broad spectrum micronutrient supplement. There is strong amount of evidence in nutritional psychiatry that providing your patient with and this is where you can find in any daily essential multivitamin, but a broad spectrum multivitamin with a broad micronutrient base, which includes all the vitamins and minerals that are generally present, the B complexes, the iron, the selenium, the zinc, all of those things. The second focus I use is omega-3 fatty acids. Continues to be great evidence that increasing intake of omega-3 fatty acids, especially the EPA component. You will notice that omega-3 fatty acids usually have both a DHA and EPA, and about 1,000 milligrams of the EPA component has really been shown to improve lots of mental health issues, ADHD, depression, anxiety, even bipolar. Appropriate, judicious use of melatonin has also been shown to improve sleep, in addition to certain adjunctive sleep aids and relaxation aids like L-theanine, which is an essential amino acid associated with improved sleep, and magnesium. I use magnesium glycinate as the type of magnesium that crosses the blood-brain barrier. All can work together to improve sleep in kids with ADHD. It seems that they underproduce melatonin. So a strong sleep hygiene routine, which we talk about, and how technology impacts that, natural sunlight and exercise impact that, but a judicious use of melatonin. I prefer to use lower doses of melatonin further away from target bedtime, which mimics more the natural circadian rhythm of our internal clock, as opposed to high doses of melatonin, 5-10 milligrams an hour before bedtime. I prefer much lower, 1 to 2 milligrams, to be used further away from bedtime. And then adaptogens are herbal, plant-based substances that have particular central cognitive effects. The most popular and very well studied one is ashwagandha, which for sure supports stress reduction and relaxation, and also transition to sleep. So those are my supplement focus. That's my supplement focus when it comes to the integrative approach to ADD. As an aside, there are several newer products on the market that are combining several of these ingredients to help specifically with the ADD issue. The one I have really come to trust and like the most is a product called FOCO, FOCO. You can find information on this product at thinkfoco.com. FOCO combines L-theanine, it combines L-tyrosine, it combines a naturally occurring acetylcholinesterase inhibitor to improve acetylcholine levels in the cognitive brain, as well as a naturally occurring non-synthetic source of green tea-based caffeine, all which I have found in my patients really is a nice adjunct and pulls a lot of these things together for my ADHD patients who are interested in taking this more integrative approach. So more on that, you can find it on their website directly. So as always, we want to hear from you. You can find our podcast on all major podcast platforms, including Apple and Spotify. Please find us at our website at yourkidswillbefine.com to download all the available show episodes and leave us comments and show suggestions. Also, our YouTube channel, Your Kids Will Be Fine Podcast on YouTube. We're looking forward to hearing from you and love to hear your thoughts. Thanks.